Hello, future nurses. Welcome back to UWorld's Next Gen NCLEX review. I am Nurse Jasmine, and today we are going to be doing a pediatrics question drill. So here is what to expect from our question drill. I'm going to read the question. I'll give you 30 seconds to answer the question the best way that you think, and then we'll walk through why the correct answer is correct and why the wrong answer is wrong. So we'll discuss them and why they're distracting. So again, I want to remind you guys and welcome. I see everybody's popping on the chat here already. So remember to share this with your nursing school friends, save it for later, like, share, subscribe, make sure you're following us. All right, let's get started. So our first question says, the nurse is assessing a 2-day-old client with tetralogy of Fallot. Which of the following findings would be a priority to follow up? 1, decreased oxygen saturation. 2, tires easily during feedings. 3, sleeps in 2-hour intervals. Or 4, has a systolic heart murmur. So priority, we want to think about what's most important, right? Our airway, breathing, circulations. I'll give you guys a couple of time to answer. Let us know where you guys are following us from, where you're joining us from. What time is it where you're watching us? I see a bunch of hellos. Alrighty, so the correct answer is going to be answer option 1. So remember, like I said, we want to think about our airway, breathing, circulations. Oxygen saturation is directly related to our breathing, so we're going to focus on that. And to talk a little bit about tetralogy of Fallot, it is a cardiac defect that causes shunting of blood between the ventricles. So we're going to have decreased pulmonary blood flow and a mix of oxygenated and deoxygenated blood entering the aorta. So it affects perfusion, right? So we're going to be very concerned when we have a decreased oxygen saturation. 1 o'clock. Someone's joining us from Portland, from Ghana in West Africa. That's awesome to see where you guys are joining us from. All right, next question. The nurse is screening pediatric clients for autism spectrum disorder. It would require a follow-up if, option 1, a 9-month-old client has not developed a strong pincer grasp. Option 2, 17-month-old client cannot kick a ball. Option 3, 24-month-old client lacks spontaneous eye contact. And then option 4, 36-month-old client cannot hop on one foot. So which of these findings would require a follow-up? Let us know. I see we got people from Chicago, Kenya, California, Nepal. How cool. Somebody says that they are in their pediatric class right now. How lucky are they? I would say pretty lucky. Pediatrics are fun. All right. So the right answer is going to be option 3, right? So this is a finding that should already have been developed by 2 years of age, meaning that there is a developmental deficit. So this would require a follow-up for potential autism spectrum disorder. And to talk a little bit about autism, it is a neurobiological and developmental disorder that is apparent by month 24. So showing little interest in social interactions like spontaneous eye contact or decreased response to their own names could be a manifestation of autism, and it would require follow-up. And then the other findings, option 1, a fine pincer grasp usually develops by 12 months. So a child that hasn't done this by 9 months is nothing to worry about. Option 2, kicking a ball usually develops around 2 years of age. So at 17 months, we're not going to be worried about this yet. And then option 4, it says hopping on one foot is an ability that does not develop until around 5 years old. So at 36 months or 3 years old, we're not going to be worried about this. All right, next question. The nurse is planning care for a 3-year-old client who is hospitalized. Which of the following interventions should the nurse include in the client's plan of care? Select all the apply. So we're going to have multiple correct answers. Option 1 says maintain the client's home routine as much as possible. Option 2, demonstrate medical procedures to the client using a doll. Option 3, ask the parent to bring the client a comfort item from home. Option 4, use medical terminology when describing procedures to the client. And then option 5, we want to encourage the parent to remain with the client as much as possible. So think about it. You're taking care of a 3-year-old in the hospital. What would you want to do with them, and what would you want to avoid? All right. Okay, I see everybody's dropping their answers. Ooh. Vanny on TikTok is doing their NCLEX tomorrow morning. Good luck to you. You got this. You're in the right place. Cool. All right, guys. So don't forget to check out our website, uworldnursing.com. This is where you can sign up to see where we'll go live next time. We'll go live again tonight if you want to watch these again. So the correct answers are going to be options 1, 2, 3, and 5, right? Nobody likes to be in the hospital, especially not a 3-year-old client. So we want to make them as comfortable as they can. We want to keep the routine close to their home routine as much as possible. We want to demonstrate procedures using a doll. This will diminish their fear of bodily injury. And then we can bring in comfort items from home, like a blanket or a toy. And then we also want to encourage the parents to remain with the client as much as possible. This would help with anxiety, separation anxiety. And option 4 is incorrect because we are not going to be using medical terminology when we're talking to a 3-year-old. All right. What time tonight? So we're going to go live tonight at 7, and it'll be the same questions. Nurse Andrew's going to go live tonight. All right, next question. The nurse is caring for a 6-month-old client who has bronchiolitis. It would be a priority for the nurse to monitor the client for 1, decreased urine output, 2, nasal flaring, 3, changes in appetite, and 4, fever. So we can talk a little bit more about, you can find at uworldnursing.com. You can see our live schedule, like I just said. You can learn more about our products and our pricing. We also have a study plan that's there, and I think it's very helpful. I feel like everybody should just take a glance at it if you can. You can see our free trial. We have a 7-day free trial. You can see sample questions and the rationales. And you can see, like I said, what I really like is the NCLEX study schedule. And then here is going to be our Spanish word of the day. It's going to be fever for fiebre. Option 4, fever is fiebre. All right, see everybody's answering. Everybody got this one right. You guys are on it. So priority, right? We're going to do the airway, breathing, circulation like we just said. So bronchiolitis is inflammation and increased mucus production of the small airways of the respiratory tract. This causes labored breathing and respiratory distress. So bronchiolitis is typically associated with respiratory syncytial virus, or RSV, like we know. The nurse should prioritize the assessment findings associated with airway, breathing, circulation, and that's going to be our option 2, nasal flaring. All right. I feel like everybody got that one right. Great job, everybody. We're moving through this pretty fast. We're question 5 already. The nurse is planning care for a 12-year-old client with sickle cell anemia who is experiencing an acute episode of pain. Which of the following interventions would be appropriate to include in the client's plan of care? Select all the apply. So again, we're going to have multiple correct answers. Drop your answers in the chat. And option 1 says maintain an infusion of IV fluids. Option 2, apply cold compresses to painful areas. Option 3, provide supplemental oxygen for the client. Option 4, request a prescription for IV pain medications. Option 5, encourage the client to perform active rate of motion exercises. So what do we know about sickle cell anemia? And they're experiencing an acute episode of pain. So remember to read the entire questions, because sometimes if you don't read it, you'll miss some parts and you'll miss a correct answer. So I see everybody sending in their questions. All right. Cool kids. All right, friends. So let us know if you guys are already using UWorld. What do you like best? We have digital note cards. We have hundreds of lecture videos that we have actually been enjoying doing those. And then we have assessments. So the correct answer for this one is going to be options 1, 3, and 4. So what do we know about sickle cell disease, right? It is a hereditary blood disorder characterized by red blood cells that become sickle-shaped, right? So rather than oval, they are like this, like a moon shape, in a sense, when they are deoxygenated. So the vaso-occlusive crisis is an acute exacerbation of the sickle cell disease caused by situations like dehydration and infection. And this causes the sickled red blood cells to clump together and obstruct blood flow. And this is what results in the pain, acute pain. So expected interventions for our 12-year-old client, it's going to be, we want to give fluids to declump that sickled cells. We want to treat the hypoxia, and we want to reduce pain. So So we're going to give an infusion of IV fluids. We're going to give oxygen to help the cells carry oxygen. And we're going to request a prescription for IV pain medication because this can be very painful. So option 2 is incorrect. We don't want to apply a cold compress. This would cause the sickling to get worse and it would make the pain to be worse. And then we also don't want to do 5. We don't want to encourage active range of motion because they're in a pain right now. So we're not going to encourage them to do that right now. Great job, everybody. Let's see. Oh, somebody said hope, hydration, oxygenation, pain management, and emotional support. I love that. Great job, everybody. Somebody says, I've been using UWorld and believe that I will pass. Most of my friends just passed with UWorld. Awesome. Glad to hear that. Alrighty, question 6. The nurse has taught the parents of an 8-year-old client with attention deficit hyperactivity disorder, or ADHD, who has a new prescription for methylphenidate. Which of the following statements by the parent would require follow-up? Option 1. I will give my child the medication 2 hours before bedtime. Option 2, my child may experience a decreased appetite when taking the medication. Option 3, my child's healthcare provider will regularly monitor my child's height and weight. And then option 4, I should notify my child's healthcare provider if my child experiences palpitations. UWorld, you guys were great. I passed 2 weeks ago using UWorld. Congratulations to Bibs on TikTok. All right, and then I also want to remind you guys that we have a partnership with NSNA, and then we're going to be doing the fall conference in Ohio in November. I was there at the Seattle conference in spring, and it was a lot of fun. Was anybody here there? Let me know, or let us know if you're going to be going to the Ohio one. All right, I see everybody. Okay, cool. So I see that somebody already talked about methylphenidate, right? What is it? It's a stimulant, right? So before we talk about that, we'll talk about ADHD. So ADHD is the neurodevelopmental disorder characterized by inattention, distractibility, and or hyperactivity. So methylphenidate is a central nervous system stimulant used to treat ADHD by improving focus and attention and increasing levels of neurotransmitters in the brain, right? So it's telling you there what it is. It's a stimulant. It's going to stimulate an 8-year-old client. Do you want to give it to them 2 hours before bedtime? No, right? So that's what makes it an incorrect statement and then needs follow-up. All right, so option 2 is an incorrect option, but a correct statement. Stimulants can suppress appetite, and we want to encourage the client to eat snacks here and there. Option 3 is a correct statement. Height and weight can be affected by the suppressed appetite caused by the medication. So we're going to be monitoring them regularly. And then option 4 is also a correct statement, making it an incorrect answer. So this here says methylphenidate can actually cause palpitations, and we would change the dose if this happens. It can also increase blood pressure, heart rate, and if it's prescribed, we don't want to give it to a client that already has cardiac issues because this would make their condition worse. Ooh, somebody on Instagram, Cuterita, I took the test on the 26th of September and passed, thanks to UWorld. Congratulations. That's exciting. I always love to see that. All right, guys, we're almost there. Hang in there. Question 7. The nurse has taught the parents of preschool-aged children about childhood growth and development. Which of the following statements by a parent would indicate correct understanding of the teaching? Select all the apply. So a good tip for this one, we should look at each statement as a true or false. Option 1, I should notify our healthcare provider if my child is not toilet trained by 24 months. Option 2, I can expect my child to be able to sit quietly for at least 30 minutes at a time. My child should be able to independently turn the pages of a favorite book. Option 4, my child should be able to communicate using at least 3-word sentences. And option 5, I should encourage my child to assist with household tasks. Okay, I see everybody's putting in their answers. Great job. I will pass And October 30th. Yes, we will. We're sending you all the good vibes, all the good energy. I'm trying to read all your comments, but they're coming in fast. Alrighty, I see enough answers there. So let us know also what other topics you guys like to see. We do all kinds of different topics, and you can always go, we will all pass. I like that. I like that energy there. You can always go back on our social media channels, whichever you want. Samantha really likes YouTube. I also really like YouTube because you can Google search for whatever you need, and you'll find our old videos. So the correct answer for this one, guys, is going to be options 3, 4, and 5. Okay. So developmental milestones, they're annoying to learn about, right? Let's be honest, but they're important to understand. So they mark the achievement of expected patterns of growth and development per age group. And this provides objective data so that we can identify the need for further assessment and intervention, as well as to track the child's progress. So expected milestones of a preschool age child include turning pages of a book, communicating more than 3-word sentences, and following 2-step directions. So we wouldn't be worried if the child is not toilet trained by age 24. This is typically normal. It takes 1 to 2 years for the preschool age children. And then we also don't expect them to sit quietly for at least 30 minutes at a time. It's hard for us to do that. So can you imagine a preschool child, right? So let us know how many of you guys are getting correct. We're going through this pretty quick and everybody's doing awesome. I feel like we're pros on pediatrics, right? All right, last question, guys. The nurse has taught an adolescent client with newly diagnosed type 1 diabetes mellitus. Which of the following statements by the client would require follow-up? Option 1, this condition can be managed by following a prescribed diet. Option 2, I understand this condition as an autoimmune disorder. Option 3, this condition requires me to monitor my carb intake. And then option 4, I understand I will have this condition for the rest of my life. So take a look at the answers. Let us know what you're thinking. All right. Shiwania on TikTok is testing on October 17th. So join me in sending her all the good luck. Let's see. 8 out of 8. Nice. Doris wants to see endocrine and cardiac and mental health. Those are great topics. Angie is testing October 11th. How cool, guys. So like I said, again, we're partnered with the NSNA, that's the National Student Nurses Association. And through this partnership, we're hosting virtual webinars throughout the year. Our next one is going to be October 20th. So you can check out uworldnursing.com to sign up, or you can check out NSNA to see where you can sign up there as well. So the correct answer for this one is going to be option 1, right? So this option requires follow-up because it's an incorrect statement. What do we know about diabetes type 1? So we know that it's an absolute insulin deficiency and it requires insulin therapy for blood glucose control. So it cannot just be controlled by following the prescribed diet. Although it is part of the care plan, it also requires insulin, and this is very important for the client to understand. And the other options are incorrect because they are correct statements. Type 1 diabetes is an autoimmune disorder. The body is attacking its own beta cells in the pancreas. Option 3, the client does need to monitor their carb intake to monitor how much insulin they're going to take. It's part of, like I said, part of the care plan. And then option 4, this is also true. This is a lifelong condition. So the beta cells in the pancreas are not able to fix themselves and require lifelong management. Let's see. Oh, somebody's pinning soon. That's how cool. All right, guys. Well, that was it. That was everything. Don't forget to visit uworldnursing.com. And don't forget to like, share, and subscribe. And like I always say this to you guys, you have what it takes to be a safe and compassionate nurse. You just need to put in the work, and we are here to work with you. Great job, and thanks for watching.